Well, in the respiratory system, the function of the respiratory system for gas exchange and also produce sound and also detect olfactory smell. And this slide shows you the structure of your respiratory system. Start from the nose, pharynx, larynx, and your trachea, your bronchi, and eventually go to your lung. So your respiratory system start from your nose and eventually go to your lung. And in your lung, you have millions of alveoli. I'll leave this to you. And let's look at the respiratory tract. Your respiratory tract can be divided into the conducting portion and respiratory portion. So conducting portion are like those pipes. Their function is to send air from the outside into your lung. Your respiratory portion are the one for gas exchange. So the respiratory bronchial and mainly alveoli. That's the main one. Okay, let's start from the nose. So the nose is the cavity for the air to flow in. So let's look at the nose. So that's the nose, and the air flow in through this part and go to the nasal cavity. And they have the nasal concave. We talk about this in the bone part, and that's the one to increase the surface area, be able to heat up the air, and the air will flow in through the pharynx. So pharynx is a fancy word to say throat. And you found it's actually connected to your mouth. So you can use your nose to breathe. You can also use your mouth to breathe. And when the air flow into here, okay, that's epiglottis. That's a cartilage. And the air will flow in through here because most of the time your esophagus, this one collapses. So the air will go into here. So when you swallow, epiglottis will flip closed and the food will go to the esophagus. And because your nose and mouth is connected, so you can do this if you like to. In your airway, you have a lot of mucosa. So that's the layers they produce. They have the goblet cells. That's the mucus gland produce mucus. It covers the whole airway. And when they're overactivated, when you get sick, that's when you have runny nose. And this shows you your airway structure, those ciliated, pseudo-stratified columnar epithelium cells. And they have the cilia, they're able to move. And these the goblet cells produce mucus, so they are able to send the mucus out. And the coronavirus, that's pretty hot topic recently. It damaged those cells. And the slide show you those cilia. So after nose, it go to the pharynx. Pharynx is a fancy word to say throat. It can be divided into the nasopharynx. That's the one connect to your nose. Oropharynx is around here, and laryngopharynx, that's here. And that's epiglottis. So when you breathe, the air will go through your trachea. But when you swallow, epiglottis will flip closed, so the food will only go to your esophagus. The larynx, also called the vocal cord, is made of a lot of cartilage. And when air flows through it, it produces sound. So that's your larynx. It's mainly cartilage. The only bone you find here is hyoid, H-Y-O-I-D, hyoid bone. And all the other are cartilage. And this slide shows you those inside structure. That's the epiglottis. It can flip closed when you swallow. And this part is your vocal cord. So there's another slide show you the vocal cord from the top view. And that's how it really look like. That's the epiglottis. And that's your vocal cord. And now the air go to the trachea. Trachea is like the windpipe. There's those C-shaped cartilage. You only have one trachea. And that's the trachea. There's a trachea structure. So here's those cartilage. Those cartilage prevent collapse. And after the trachea, you go to the bronchi, primary bronchi, secondary bronchi. It start to branch out. So the bronchi is like a tree system. If you imagine a tree in front of your house, you have one trunk and divide to two main branches and divide again. And when you reverse it, that's like your airway. So you have the primary bronchi, secondary bronchi. Every time they branch, the number exponentially increase. So eventually you reach the bronchiole. And these are the small airway. Each one is smaller than 1 millimeter. And when they start to branch out, those airway branch out, they have less and less cartilage. And eventually when they reach the bronchiole, they have no cartilage. All of them are smooth muscle. Because all of them are smooth muscle, you can constrict them. And when you constrict them, it's pretty serious because now the air won't be able to reach your lung. And the sympathetic system, we talk about this in the nervous system, this can cause the bronchial dilation because when you are fighting the bear, you need more air to go to your lung. So we can take advantage of this. We can create the medicine totally mimic sympathetic function, and that's how they treat asthma. They completely mimic the sympathetic function, and that medicine is like norepinephrine, the neurotransmitter released by sympathetic nervous system. It can cause the bronchial dilation. So that's how you treat asthma. The receptor in the bronchiole is beta-2 receptor. It's adrenergic receptor. And use the beta-2 agonist. That's the one will bind with this receptor and do exactly the same function as sympathetic nervous system do, which is cause the bronchial dilation. So that's your airway. Start from the trachea, primary bronchi. It start to branch out. So it becomes smaller and smaller and less cartilage. Eventually they reach the alveoli. You have millions of them. These alveoli are like air bubble. So each lung you have about 150 million of them. And you have a lot of them to increase the surface area for gas exchange. So the total surface area in your lung is like half of the tennis court. And this slide shows you, okay, these are the alveoli. And in each alveolus, you have at least one capillary waiting there, so the oxygen can go from the alveoli into the blood. So this shows you those alveoli. And this part of the bronchiole called respiratory bronchiole, they can actually do similar function as the alveoli. They can help the gas exchange. And this slide shows you those alveoli. It looks like under the microscope, it looks like the toast you eat for breakfast. A lot of empty space, and that's for gas exchange. In your alveoli, you have two kinds of cells. Most of them, over 90% of them, are the type 1 alveoli cells. And they are made of simple squamous epithelium cells. So they are one layer and pretty flat. It helps gas exchange. And type 2, you have a small percentage. They are type 2 alveoli cells, also called septal cells. Their function is produce surfactant. Surfactant is made of cholesterol. Its function is decrease the surface area, surface tension. So it helps, especially for baby. Their muscles are small. It helps the decrease the surface tension of the alveoli. So easier to expand the air bubble, those alveoli. It helps breathing. And you also have the macrophage to fight the pathogen. And surfactant is pretty important for baby, especially the baby's muscles are small. And type 2 alveoli cells, they mature pretty late. They mature in the 3rd trimester of pregnancy. And the reason is you don't need to use your lung until you were born. And for premature baby, it's a problem because their muscles are so small. and they may not have enough surfactant and to keep the lung extend. So in the 20th century, some premature baby suffocate to death. And now it's not a problem. Now we have the artificial surfactant. It's made of cholesterol, so they can actually help the lung to extend for the premature baby. Okay, let's take a break.